Alabama is one of 10 states that has an expanded Medicaid, which would provide care for more mothers during and after pregnancy.
Which side are you on? Which side are you on?
Adam, you've got some cool news on Medicaid expansion. Talk to us about it.
Yeah, I'm always down to talk about Medicaid expansion. It's an issue I'm passionate about, and I've got some news to report. And so, this is an issue that affects working class folks across Alabama. And first things up is from Cover Alabama Coalition. And I wanted to point out this new press release they put out this week. Medicaid expansion, a proven solution to help Alabamians stay in the workforce, according to a new report. So Medicaid expansion is a proven solution to help people join and stay in the workforce. A new report from Community Catalyst spotlights. States that have expanded Medicaid have seen a greater increase in labor force participation among people with incomes below 138% of the poverty line. They've seen a greater increase than states like Alabama that have not expanded. And I think that's really relevant considering some of the conversations we had recently about our governor, right? Governor Kay Ivey said that people needed to get off their fannies and join the workforce. Well, here's more evidence that Medicaid expansion can help people join and stay in the workforce. Policymakers' refusal to expand Medicaid has left nearly 300,000 Alabamians in the Medicaid coverage gap, where they earn too much to qualify for Medicaid, but not enough to afford private insurance. The lack of coverage hits people of color in Alabama especially hard. Alabama Rise's Cover Alabama campaign director, Debbie Smith, said every Alabamian should be able to get the medical care they need to survive and thrive. Removing financial barriers to health care would make our workforce more robust and more productive. It's time for Alabama policymakers to close the health coverage gap and invest in a healthier future for our state and for our people. Alabama is one of only 10 states where workers cannot access quality, affordable health care due to limited Medicaid coverage. Almost half of Alabama residents in the coverage gap are people of color, and 60% live below the poverty line. And I think that's worth teasing out, right? The racism and oppression in this state and in this country. We talked, with Blair Kelly earlier this morning about the black working class. And almost half of Alabama residents in the coverage gap are people of color. Almost half of Alabama residents are not people of color, right? So that's a big disparity. Nearly half of Alabama workers do not get employer-sponsored health insurance, the new report from Catalyst found. And that really is big. Nearly half of Alabama workers do not get employer-sponsored health insurance. And there used to be a time where fully paid employer health care was a standard in this country, right? There are folks who remember that, folks who experienced that. And here we are in the state of Alabama in 2023, nearly half of workers do not get health care through their job. So that forces tens of thousands of Alabama families to make tough decisions, either to forego needed health care or take on thousands of dollars in medical debt. When Alabamians are delaying the care and treatment they need, that hurts their productivity and their well-being. And the need for expansion is especially urgent right now as state officials unwind COVID-19 pandemic-era Medicaid policies, which is leaving about 61,000 Alabamians at risk of losing their Medicaid. Without Medicaid expansion in the state, many more individuals and families will be left with no options for affordable health coverage. Closing Alabama's coverage gap could create an average of 20,083 new jobs per year and have an estimated positive economic impact of $11.36 billion over the next 6 years. All right, 20,000 jobs. How many economic development projects do we see politicians brag about that can even compare with those numbers. Over $11 billion in 6 years in economic impact. I mean, that is a huge stimulus. And Medicaid expansion would be one key solution to improving workforce participation rate across the state, which, again, the governor has made a big deal about, big business has made a big deal about. A lot of the bosses and politicians are talking about workforce participation rate, right? They claim nobody wants to work anymore. They claim they're having trouble finding workers. Okay, well, as we've talked about on this show before, and we'll continue to talk about on this show, folks have to be healthy. All right, folks who have illnesses, who have disabilities, who have needs for medication, needs for regular treatment by doctors, right? They need that. And there are some folks who are unable to participate in the workforce fully because of lack of health care. And because the Medicaid restrictions are so severe in Alabama, you basically can't work and receive Medicaid. So it puts people in a real bind. Healthcare in America is a racket. It's far too expensive for far too many people. But here is one policy solution that is so mild, so modest, so moderate, so easy to do, where we could help about 300,000 of our neighbors here in this state. So I wanted to point out that study because it really, connects with the rhetoric we've seen about labor participation. And this comes about a month after another study, this one issued by the nonprofit think tank, the Milken Institute. And this one determined Alabama has the highest rate of mothers dying from pregnancy-related issues in the country. From Walisha Morris's AO.com article, Milken Institute's Associate Director of Health Economics, Dr. Catherine Sachs, one of the report's authors, said from 2018 to 2021, 150 Alabama mothers died. It's important for people to know Alabama is really the heart of the crisis, Sachs said. So it starts at home. People really need to start thinking about proven policies to improve these statistics and work on making them happen in Alabama. Alabama's infant mortality rate is also one of the highest in the United States. She said states that haven't expanded Medicaid tend to have higher rates. Alabama is one of 10 states that hasn't expanded Medicaid, which would provide care for more mothers during and after pregnancy.
Hey, 5 seconds. Just wanted to say that this is only possible because of our donors. If you want to see more of this, then consider donating yourself at tvlr.fm/donate.
So here's yet more evidence of the abysmal state of healthcare in Alabama, a state that is supposedly governed by pro-life family values. Yet more evidence of how Medicaid expansion can save lives, improve lives, save hospitals, increase workforce participation, create jobs, save cost, and produce a massive economic impact that far outweighs the average economic development project that politicians love to brag about. Our politicians love to bribe companies to locate in Alabama, with the promise of hostility to unions, low wages, lax regulations, and generous subsidies and incentives. And the politicians love to then brag to us about what a great thing that is. It's all fantastic news, and we're all supposed to be excited about it because of the job creation. Well, Medicaid expansion would create 20,000 jobs in Alabama, and that's across the state, from the shoals to the wiregrass, from the beaches of Baldwin County to the mountains of DeKalb County. So for those reasons and many more, I've been pushing our labor movement in Alabama to take a stronger stance on behalf of the 300,000 working-class Alabamians who stand to gain directly from Medicaid expansion, and on behalf of the entire Alabama working class that would benefit from the healthier, more prosperous Alabama that Medicaid expansion would bring. In July, I brought a resolution to my local union, IATSE 900, which was adopted by the general membership. We formally endorsed Medicaid expansion, joined the Cover Alabama Coalition, called upon our elected officials to take action, and called upon other unions to follow our lead. In August, I came to the North Alabama Labor Council seeking similar support, and I'm proud to report the council has joined the Cover Alabama Coalition and the fight to expand Medicaid in the state. In response to the IATSE 900 resolution, which I mailed to Governor Ivey, she did write me back yesterday. She says she's giving it, quote, serious consideration, but that she's concerned about how to pay for it long term. I certainly hope that the governor is giving it serious consideration, given how many years we've been fighting this fight, given how many of our neighbors have suffered and even died as a result of Alabama's inaction. And on the topic of cost, it's worth mentioning that this has been studied extensively. Between the generous but time-sensitive extra federal dollars available, the cost savings it would bring in various other areas of the budget, and the significant revenue from its economic impact, there's every reason to believe that Medicaid expansion will more than pay for itself in the long term. That's not just me. That's our state universities, that's the economists, the experts who've done the math and studied this issue, and the evidence is overwhelming that Alabama can easily afford this long term. And that's before we even get into the budget priorities and the fact that we never ask how we'll pay long term for the massive transfers of wealth to corporations. There's pork spending that could be redirected, and of course there's always plenty of ways we could raise revenue in this state. Though again, according to all the facts we have available, it won't even be needed for Medicaid expansion. If anything, we can't afford not to do it. So I'm really proud to see my union, IATSE 900, as well as my CLC, the North Alabama Labor Council, join this fight, a fight that disproportionately impacts the working poor of this state. The cooks, the cashiers, barbers, drivers, mechanics, stagehands, and hundreds of thousands of working class folks who just make too much to qualify for Medicaid, but not enough to get the real insurance they need. Obviously, most of our union members are not directly impacted, as most have employer health care negotiated in their union contracts. But as we've talked about today, the labor movement has always sought to raise the standard for all working people. This is such a no-brainer policy solution that will bring us a little bit closer to a better Alabama for all. And I believe it's important that the labor movement add our voices to the chorus of voices demanding Medicaid expansion. The more voices we add, the louder we are. And it's going to take more and more public pressure, more and more people power and citizen engagement to push Alabama's leaders to do the right thing. We can't sit back and hope they do it. We know how that goes. We have to keep fighting. So I encourage everyone listening, take a minute, participate in Cover Alabama's week of action that they're running right now. You can take 60 seconds, contact your elected officials, take a few more seconds to share the post on your social media, take a few minutes to have conversations with family, friends, neighbors, or coworkers about this issue and get them engaged in this fight. And you can speak at your next union meeting about this issue and encourage your union to join us in the Cover Alabama Coalition. I'm happy to help you with that, so hit me up if you want resources or sample language or just want to talk about it. But I really just encourage everyone who is listening, who is in Alabama, follow Cover Alabama, get involved in this. I'm hearing that we are closer than ever to securing something. We'll see. You know, the governor said serious consideration, so we need to definitely ramp up our voices and make sure we're heard.
You just saw a clip from the Valley Labor Report. We are live every Saturday morning from 9:30 a.m. till 12:30 p.m. And we pride ourselves on keeping all of our content free to everybody so that we can talk to as many working folks as possible. If you support the work that we're doing, you think that it's important, you think that it's good, then consider making a monthly contribution to the project, and you can do that on our website, tvlr.fm.